Hello friends, you are listening to the Maitri podcast between friends, Conversations with Maitri. This is your host Nandini Ray with my production team member Daman Kiwana welcoming you all to this meaningful discussion. In today's episode, we will be discussing healthcare systems involvement in preventing family violence and partner violence. We all know that family violence is a complex public health issue and medical professionals are the ones who take care of the wounds and trauma that are caused by family violence. But many people may not know that healthcare providers not only treat these wounds, but they also take a huge role actually in prevention field. To discuss their work in the prevention field, we have invited Dr. Rakesh Chaudhary and Dr. Priyanka Jain, who are actively involved in Kaiser's Family Violence Prevention Program. Before we get started with our discussion, let me say a few words about our today's guest. I'm so happy to have them here. Dr. Rakesh Chaudhary is currently serving as the physician-in-chief for the Kaiser Permanente Santa Clara Medical Center. His other professional affiliations are Fellow of the American College of Physicians, Board Member of the Permanente Medical Group, and Board Member of Joint Venture Silicon Valley. He has a trusting relationship with his patients. Dr. Priyanka Jain is a senior physician in the Department of Adult and Family Medicine. She is the physician lead for Santa Clara Kaiser Family Violence Prevention Program, and she guides doctors and staff to screen and help survivors of family violence. Dr. Chaudhary and Dr. Jain, thank you so much for coming to our show.
Thank you, Nandini.
Yeah, thanks, Nandini, for having us.
Let's start our conversation with an introduction of Kaiser's Family Violence Prevention Program.
So the Kaiser Family Violence Prevention Program actually started in 1998 in our Richmond facility, and it was run as a small pilot project. But by 2002, it had spread to all the Kaiser facilities. We were doing it slowly and steadily, but we didn't really have a very, very, very fleshed out program. What was done was if anybody showed up, and had signs of, I told them they were being abused, they were being connected to the resources. But as of now, the Family Violence Prevention Program that Kaiser Permanente as an organization has is across all the facilities in Kaiser. Every patient who is seen in the Department of Medicine, in the Department of OBGYN, in the Department of Family Medicine is asked somehow, either by the doctor asking them or the medical assistant asking them if they are safe at home or have they ever experienced any kind of abuse, physical, mental, emotional, in their relationship. It's a huge group of physicians, nurses, educators, social workers, and leaders like Dr. Chaudhary who are there to give us the impetus required.
Yeah, and it's really been a remarkable journey from my perspective. We've known that intimate partner violence, family violence has been a problem for decades, really, in medicine. There's some studies that were done very early by Kaiser Permanente, actually, on adverse childhood experiences, otherwise known as ACEs. And we've known that this has a major impact on people's health for a very, very long time. But the problem really was how do we deal with it? How do we identify it? When we identify it, what do we do? And it really took time to really develop that approach. And I think at this point, we are at a level that our program is very mature and is very well set up to not just identify when intimate partner violence or family violence is going on, but then to actually do something about it, to intervene on behalf of our patients.
Wow, this is a wonderful initiative to prevent family violence, and kudos to Kaiser medical professionals in developing and implementing such an effective model for family violence prevention in the healthcare setting. We are at Maitri, we are also seeing that these days we are fortunate to see lots of activities in prevention and advocacy fields to end family violence, partner violence. But we all know that this is not an easy work, not an easy task. There are a lot of statistics out there that show family violence and partner violence cases are always underreported. And and in most cases, victims, they don't share their trauma or their situation with anyone, not even their family members or friends, close friends, and forget about sharing that with a stranger like a doctor. It is possible that when they go to hospitals and they see their doctors, they don't know if they can trust their doctors and nurses, they can share their trauma with them. And sometimes victims, they don't talk about their situation for various reasons. Probably the same case, they don't call any agency because they feel that probably tomorrow will be a different day. Probably tomorrow abuse will stop, abuser will change, or probably they think that I don't want to put shame in my family. They're thinking about their children. So many cases they don't talk about that abuse, their abusive situation. So how do you find out what kind of screening process you have in place in assessing the level of danger for familial violence or partner violence in the center?
So Nandini, you framed it so well. Family violence is what I call the silent pandemic that's been raging in our community for years. If you look at the numbers, 1 in 9 women will suffer some kind of abuse in their lifetime. If a woman is murdered, there is 1 in 4 chance that the perpetrator was somebody that she knew. That's how significant this pandemic is, and it is unfortunate and so sad that there is this stigma, there is this shame attached to it, and our society's attempt to normalize the behavior. That this is how it is supposed to be, this is how the relationship is supposed to be, and you should not speak up. And you and I both know in our community, it is rampant, and it has been normalized.
All communities actually.
Yeah, and it is very sad. But the way we try to screen is our attempt is every patient, whether it is male or female, over the age of 18, when that person is seen in the Department of Medicine or in OBGYN in Santa Clara, that patient is taken into the room by themselves. That is what we call rooming alone, meaning they do not have their partner with them. And then we have trained our medical assistants, the people when you come in, they check your weight, they check your blood pressure. Similarly, they will ask you these questions, which we call the screening questions for family violence. It is like, do you feel safe at home? Does anybody hurt you, injure you at home? And then, have you ever been in a relationship where you felt threatened? So this is a screening questionnaire that every patient who is seen in our department is asked. Now, if the patient feels uncomfortable and they don't want to answer, which is reasonable because they don't know the medical assistant, they might tell the medical assistant, I don't want to answer these questions. Fair enough. In which case, the medical assistant will come and tell the physician that I asked these questions, but the patient did not want to answer. Then it falls on me, the doctor, to ask them their questions. In general, we have been seeing the patients, like Dr. Chaudhary and me, we are both primary care physicians. So we have been seeing these patients over time, and we have a relationship. And most of the times we can ask these questions. But if they say no, they say no. But studies have shown that we have to ask the question at least 7 times before they will say yes. So this is what we call, we planted a seed. So that sometime, like in the future, they might open up about it. And this is something that we've been doing for the last 7 years. Every patient, every time, is brought into the room by themselves, ask these questions. That's how we screen for family violence in Santa Clara.
Do you see any roadblocks in following the screening process?
Yeah, I think, Nandini, to build on what Dr. Jain just said, the key is you ask again and again and again and again, and you never stop asking. Because we know, as Priyanka just said, it might be the 7th time. It might be the 20th time that you ask that someone will finally say yes. And then you mentioned the roadblock. The main roadblock is these are tough questions to ask. And it took us time to build that comfort level. So by asking every single time, our medical assistants, it got comfortable for them, right? That they became, because these are very tough questions to ask when the first time you're asking. These are intimate questions. These are questions about something that is really very private for most people. And so we had to get good at it too by asking again and again and again. We get more and more comfortable with it. So I think that repetition really helped a lot. And we mentioned normalizing, right? Actually, if we ask this question every single time, it's a normal question. It's like, do you smoke? Do you exercise? Do you take your medications? Oh, and by the way, are you in an abusive relationship as well? Because it has such important ramifications to their life and to their health. So I think that's been the key. We just keep asking.
Yeah, that's a good thing. But I was wondering, what do you do with immigrant patients? For example, if someone is telling you that, oh, my partner doesn't speak English, please let me go in the room with her or with him, and I will translate for my partner. So in that case, what do you do?
Excellent question, Nandini. This is something that comes across so many times, but we are fortunate. We do have a lot of physicians from different backgrounds who speak a lot of different languages. So we have that useful pool. We have a medical assistants, plus we have the language line. And sometimes, if the partner is insistent on coming back, the medical assistants will say, okay, let me take them in. Let me talk. The doctor would like to have a minute with them, and then we can bring you in. But we use the language line over the phone, over the video. We use our staff, our bilingual, multilingual staff, our multilingual physicians to ask the questions. That is one way that we will try to bypass this little obstacle that comes with the abusive, like the abuser wanting to come in, because that's a huge red flag that the perpetrator wants to come in with the patients.
Yeah.
They don't want us, the physician and the patient, to have that few minutes of private moment.
This is something we have to overcome as well. Grooming somebody alone is also a difficult thing to get used to doing. But again, when you do it over and over and over again, and it becomes the standard, then it becomes much easier. And then the medical assistants are empowered to say, no, I really have to room your spouse alone, because that is what we do here. And that's what my doctor is telling me to do. And so again, it empowers people to do the right thing. We had to work on it because there was lots of times, well, not a lot of times, but several times a day that a partner would insist to come in. Now, if that partner is very insistent, like angrily insistent, well, then our radar goes way up. As physicians, as medical assistants, we're all like, okay, there's something going on here. I need to dig. And then the doctor will come in and say, okay, well, it's time for me to do the exam. Can you step outside? And then as we're doing the exam, we'll start asking some more questions, because that is a really big red flag. An angry partner insisting to come into the room, boy, that really sets off our radar.
Actually, this is such a sensitive and delicate issue that sometimes even doctors, they are also in a very uncomfortable situation. If someone is asking that, no, I have to, and sometimes we have seen that perpetrators are so manipulative. I mean, they can be very nice, and sometimes they will not show their anger to you. They will show their anger to, the victims when they are home alone, and probably they will request you, can I please come with my partner, because my partner doesn't speak English. So this kind of, it's a very delicate, very sensitive issue. At the same time, what we have to do, we are doing, as advocates, we are doing, as medical professionals, we are trying our best to help survivors, but it's not an easy task. But yeah, that's what you say, Dr. Chaudhary. We have to keep going, keep doing whatever we are doing so that we can help.
Yeah, and that's part of the isolation of intimate partner violence, isn't it? Right? And somebody really making somebody beholden or completely dependent on the abuser. I mean, it's a classic manipulation of the abusive relationship. You're right. We worry about people that are isolated for any reason. And one of those isolations may be language, right? They were never allowed to learn English. They're never allowed to go out of the house alone, to be out in the community, to just pick up languages. So it makes us think. It makes us pause. It makes us dig a little deeper when we have that insistent partner, even if they're not angry, even if they just keep insisting, hey, I really want to be there. And, we say, oh, we'd love to have you there, but I need a minute or two alone, because there's just parts of this that we have to do alone. And that's how we approach it. But again, it's not just asking the questions, because a woman or a man, but more frequently a woman could definitely say no to our questions in a way that makes us think that she's actually trying to say yes, that I'm in an abusive relationship. And we've all had those stories where you know there's something going on. And what do? You just keep asking in a supportive way, and you just keep digging a little bit. And maybe you bring that person in again because you're really worried and you're like, no, something's going on here. So, we have our times when our suspicion goes up. There's certain medical diagnoses that make our suspicion go up. Women that come in maybe with recurrent headaches, recurrent abdominal pain. These are areas where we'll start to dig a little bit deeper, even if the person says no initially to the question.
And in our culture, and all of us are South Asian here, and we know that in our culture, extended family members, sometimes they take part directly and indirectly in that family abuse and violence. And it is possible that sometimes partners are not going with the victims, and sometimes mother-in-law or sister-in-law, they are insistent that, oh, I am like her mother or sister, I can go in with her. And you never know. I'm not saying that all mother-in-law are, like that. My mother-in-law is like my own mother. So there are mixed baggages here. I'm sorry if someone is listening and thinking that I'm a mother-in-law. I have good intention for my daughter-in-law. Yeah, there are so many good mothers-in-law and sisters-in-law there out there. But we have also seen some cases where extended family members, they took part directly or indirectly in perpetrating abuse. So it's a very domestic violence, familial violence, personal violence. This is such a gray area that you don't know where to step in, where to be. We have to be very careful, but at the same time, we have to do our best. And as you said, we have to keep doing whatever we are doing.
अगर आप या कोई और जिसे आप जानते हैं जो घरेलू और डोमेस्टिक वायलेंस से गुजर रहे हैं, कृपया मैत्री से संपर्क करें। मैत्री की सेवाएं बिल्कुल मुफ्त और विश्वसनीय हैं। हमारी सेवाएं हिंदी, पंजाबी, मराठी, गुजराती और अन्य दक्षिण एशियाई भाषाओं में उपलब्ध हैं। You can call us Monday to Friday 9 to 3 p.m. on 188-862-4874. For after hours, leave voicemail in your language. You can also email us at maitri, maitri@maitri.org.
Another question that is popping up in my mind when we are talking about finding out screening process, that do you provide any educational session or training to your hospital staff? Do they have adequate training to identify abuse?
Excellent question, Nandini. That's part of my job, to provide the training to our physicians, to our staff. I do like 3 training sessions a year for my physician colleagues, where we have looked at different aspects of abuse, one from why abuse is important to like the silent pandemic, like Dr. Chaudhary mentioned, like a patient is coming again and again with headaches and abdominal pain, fatigue, sleep problems, and everything else is normal. You have to start looking out, you have to identify the red flags. When do you start thinking about abuse? We did a session on where we got a local person to talk about how in the Bay Area and the Silicon Valley technology is being used to gaslight these people, and how people are controlling their devices so that they have no access. We did a session during COVID, like how COVID was affecting it and how they were being manipulated. And the same thing goes for the staff. So a lot of education, ongoing education on different aspects. It's part of our training.
Yeah, and I'll just comment as somebody who's attended those sessions. These are some of the most powerful sessions that we've had in terms of education, because it's not just education. They really talk. Priyanka has just done a wonderful job coming up with different ways for us to understand the impact that this has on people, and to really empathize with them. Some of these are the most emotional medical education series that we ever go to, because they really shape you when you hear some of these stories, and especially when we've had people who have either been friends of survivors or survivors themselves come speak to us. Oh my gosh, it leaves such a lasting impact on all of us as providers. And then again, also educating our medical assistants who are asking a lot of these questions. Again, when we put these questions out, Nandini, there was a lot of reluctance, like, oh my God, these questions are so hard. How are we going to do this rooming alone? And what it took was Priyanka and the whole team really emphasizing the importance of the work. Yes, this is hard work, but it's really important work. And I think those are really important messages that Priyanka has hit home again and again and again with us.
Kudos to you, Priyanka and Dr. Chaudhary, both of you and all your team. They're doing wonderful work. And from Maitri, I attend Kaiser Family Violence Prevention meeting, and I know how much effort you are putting into family violence prevention field. Hats off to you.
Nandini, Dr. Chaudhary gives me the credit, but, it was his support. He was backing me. I had a free rein. I came up with the idea. He implemented it. So it was all teamwork. It wasn't just me.
And Nandini, I love having you at our meetings. We have several community partners that come to our meetings. This is another really fantastic idea that Priyanka implemented long before I was involved, because you guys have been involved with this group for a long time. I love those community partnerships because you guys bring to us also so much valuable learning, right? Not just the stories, but what you can offer. Because we talked about this before. You don't want to just identify it. Once you identify it, you want to help somehow. And I think the community partnership that we've had with you and others in the community helping our patients with intimate partner violence has been instrumental in our program.
Yeah, thank you. So do you mention any statistics of intimate partner violence cases or familial abuse cases at least in your facility? I know it's very hard, but by any chance do you mention any statistics?
We have robust statistics on everything. Yes, we have statistics on everything. We have statistics for like when the MA rooms the patient was roomed alone, the questions were answered. If there was a yes question, what did the doctor take care of it? Did we give them the resources? Did we follow up with them? We have stats on everything. So Kaiser is sitting on this database of 12 years worth of data on family violence. We have a lot of data.
Wow. Yeah, and it's really what we always say here, that if you don't have data, how do you know you're improving?
Yes.
And so we have really very much measured ourselves. Really an incredible journey that we at Kaiser Permanente Santa Clara were on. And over the years, just seeing this steady march upward in identification of cases. And that's the most important statistic out there, right? We do a calculation based on what Dr. Jain just said, 1 in 9 women. So we know what we think, how much intimate partner violence is out there just by those statistics. And then we measure ourselves. Well, how much are we identifying? And we measure ourselves against what we expect to be out there in the community. Because I think if you don't measure, you don't know if you're getting better.
Absolutely. I completely agree with you. If you don't measure, if you don't have data, then how do you know that whether you are on the right path or not? So absolutely. So do you see any difference in this COVID situation? Because for us, we are seeing that people are, when, COVID is hard for everyone, whether you are in an abusive situation or not. It is impacting all of us in different ways probably, but it is impacting. And think about it, someone trapped with their abusers under the same roof, and it's so hard for them. So do you see any difference in COVID situation, statistics wise? I'm not saying that people will, it is automatically people will call you and tell you about their abuse. Maybe they are not. They will do the same thing what they have been doing for last couple of years. Maybe they are hiding. They will be hiding. But as physician, do you see any difference or the same?
So Nandini, in this past year, it was a little different because we really were not seeing so many patients in person. But we did receive a lot more messages from patients, like we received emails about abuse.
Oh.
And people were reaching out for help. Or we did see a lot more anxiety, stress, insomnia, headaches. We saw that, and we saw a lot more physical abuse. We definitely filed a lot more reports in the past year. And there were different types of abuse going on. There was financial abuse. They were not letting them give their resources. They got access to their Kaiser, they were trying to control their communication with the physicians, like they had access to the kp.org account and they were sending us emails so they could go through their chart, listening in for the video visits or to the telephonist. It was a difficult time for everyone.
And Dini, I think the biggest concern for COVID, right, it is such an isolating pandemic. And we know that intimate partner violence is a very isolating problem. These, mostly women, but men as well, but mostly women are feeling already so isolated because their abuser tries to cut them off from the rest of society. And COVID just multiplies that tenfold, the isolation part of it. And then Priyanka mentioned something really important, which is for many months last year, people stopped coming in. They were so afraid of COVID and they thought that we would give them COVID if they came in to see us somehow. They just weren't coming in. And so we were very worried in general that we were going to miss this problem. And we were worried in a lot of different things, cancer screenings and blood pressure checks and all this stuff, but definitely intimate partner violence. I think this was weighed heavily on all of our minds. Because when a woman comes in for her routine care for whatever health condition, that's an opportunity to ask the questions again. If she's not coming in, well, we've lost that opportunity. So now we have to hope that they'll reach out by email or maybe they'll reach out in some other way. But it's hard to ask those questions when people were coming in less for several months.
Yeah. And video calling may not be as safe as we think. If somebody can have their abusers watching them when they're on video call with their doctors. So, and hopefully COVID will vanish from our radar soon and we will feel normal again. I'm hoping it will go away soon.
अगर आप या कोई और जिसे आप जानते हैं जो घरेलू और डोमेस्टिक वायलेंस से गुजर रहे हैं, कृपया मैत्री से संपर्क करें। मैत्री की सेवाएं बिल्कुल मुफ्त और विश्वसनीय हैं। हमारी सेवाएं हिंदी, पंजाबी, मराठी, गुजराती और अन्य दक्षिण एशियाई भाषाओं में उपलब्ध हैं। You can call us Monday to Friday 9 to 3 p.m. on 188-862-4874. For after hours, leave voicemail in your language. You can also email us at maitri, maitri@maitri.org.
So what I'm hearing that you are doing a wonderful job training your staff, doctors, nurses, and you are doing your best to provide right health. Do you do something to educate your patients so that they can identify red signals of abusive relationship for the damage happened? Because when they're coming to you and you are asking questions that are you hurt or are you threatened by someone, maybe the damage is already done. So if they know anything how to identify abuse in the relationship, maybe they can prevent before it happens. For example, like doctors always tell us that don't smoke, don't eat too much red meat, eat healthy food, do exercise. Something similar do you do to educate your patients? Do you have any protocol?
Yes. If you come to our center and you use any of the restrooms, so you will see these posters, it says, you are not alone. And then it asks you these questions. And underneath that, we have those tear-off sheets. So that's one way that patients know that this is not normal behavior. Nobody should be hitting me. Nobody should be putting me down. And then you have the resources. So that's one way. Plus, what we have modeled our screening process after, it's a process called CUES, which says confidentiality, universal education, and support. So universal education is education not just for our doctors and for our staff, but also for our patients. Oftentimes when we ask these questions, we give them information about what abuse is. And we say, I totally get it that you are not going through this, but just in case you have a friend or someone who needs this information, and that's an opportunity for us to give them that information. So we have that information that we have passed out. And more so during the COVID time, we just sneak it in when we send them any other information. So that's one way of educating our patients.
Okay, at least they know that if they are abused, then they have hope to get help.
Yes.
Yeah, somebody can help them.
And we also have kind of on a rotational basis throughout the year, we'll have certain displays that will talk about intimate partner violence. We have sort of a silent witness display, which is kind of a wall of stories, survivors of domestic violence. And very uplifting stories that really tear at your heartstrings. You hear what was going on, and then you read how that person claimed their life back. And those are always in various languages. So, we talked about the language issue, and we will have it in, we've had it in English, then Vietnamese, we've had it in English and Spanish. And
Nandini provided one of those where, there were the different outfits, and then Aki came up with those dolls, that gained a lot of interest
among our patients and our staff. It really opens people's eyes. And so that's, love having those rotational things go through our medical centers to raise awareness.
It's wonderful that at least people know that what is going on. And sometimes people don't know that they can reach out for help, and probably they are new immigrants. They don't know that there are help out there. There are various organizations and medical system, legal system, they can help them. They don't know that, and they suffer in silence. So it's wonderful that they can see that if they face any abuse, they can reach out to their doctors or any agency. At least when you are showing this place and when you are sharing from any agencies like Maitri, Yaki, YWCA, their or Next Door Solutions, their numbers or names, people know that whom to call, and that's great. We have seen our clients sometimes they told us that after suffering 8 years, after suffering 12 years, now I am reporting this abuse. I thought the abuse will stop. And I went to medical, my doctors when I had my miscarriage or when I had my shoulder dislocation or any other bodily injury. And I lied to my doctors. I told them that I slipped from staircase. I bumped to a wall. When doctors, they're seeing patients, probably they're suspecting something, but they cannot say or do anything unless clients, they ask for their help. So in that case, if you feel something is wrong, but you cannot do anything because the client is not sharing the story with you, full story with you, so do you have any safety plan so that you can share that how can your patients can be safe?
We give them the information. We tell them about the different resources, like we tell them about the shelters that are available. You can't force anybody to say yes. You can't force anybody to get help. We just empower them with more information. We try to be altruistic in that, like, hey, you're not doing it, but somebody else. So if you know somebody, make sure you have a contact you can go to. Make sure you have your papers, important papers, some money set aside. Make sure you have a safety plan. Those are things we get because, when a person says yes, we do get a social worker involved. The social worker does help guide them through that.
Yeah, we also have, Nandini, we have social workers on staff here. We have therapists in our clinics. So we have a lot of help that we could offer here locally, and we give them all the resources that are out there in the community that are there to help them. But you're right, they have to say yes. But again, when we start to get suspicious, we as physicians must dig, right? We must keep asking. We must ask it in different ways. Maybe we set up a follow-up appointment, and really what we're thinking is at that follow-up appointment, I'm just going to ask them again, right? That's our plan, right? And so I think there's ways that when we're really worried about somebody, we have our ways of trying to figure out what's really going on. And, I think the other thing you point out, Nandini, is we cannot judge these people. We cannot be angry that they lied to us 15 times and said no. We have to say, okay, they're going to say yes when they're ready to say yes. And I just have to keep asking them because I've got to get to the bottom of this. So, there's so much judgment put on these people that are victims of intimate partner violence. And that's part of the problem, isn't it? I mean, that's what keeps people quiet is because they feel like people are going to judge them. We cannot do that. We absolutely cannot judge them.
They feel it's their fault. It's my fault that he's hitting me. It's my fault that he's doing that. I think it's a cultural thing. It's the way they are brought up.
Also, we shouldn't be, forcing them to take any decision. We at Maitri, we do that. When people are calling us and they tell us that I've been going through ABC, clearly seeing probably the abuse, but we cannot tell them that unless it is life-threatening situation, we cannot tell them that you should do this or that. We just provide information. It is them who needs to decide it's their life That decision should be informed decision.
Absolutely.
I mean, if they know the resources are out there, what are the laws, what are the resources, how can they be safe? And after that, if they see that this is my decision, and we respect that. And it is possible that we have seen that one person has been calling us for the last 7 years. She doesn't want to do anything. Maybe it's her hope that because she genuinely loves her partner and she thinks he will change, or maybe she's thinking about her children. But whatever it is, we respect that. We wait whenever she tells us that yes, I want to do A, B, C, we will help. And as Dr. Chaudhary says it, we shouldn't be, we shouldn't judge. Yeah. So it's their life. We are not in their shoes. We don't know why they're taking that decision. I know personally that both of you are so passionate about helping survivors, preventing family violence. So what motivated you to join this program and work in prevention field?
For me, it's easy, Priyanka. Seriously, I was literally walking in the hallway one day and Priyanka cornered me and said, "Hey, Rakesh, this is a big issue and we need to do better." And, after like literally 5-minute conversation, I'm like, oh my God, this is a huge issue. And you're right. We need to do better. And I think, what motivates us is patient stories. So we all have, unfortunately, awful patient stories that we have seen. For me, it was a woman who ended up in the ER, her whole face bruised because her partner had beat her up so badly. And I remember visiting her in the hospital because I had my suspicions, and I had even asked her maybe a year ago. I had seen her many times that year. So this is a decade ago, maybe 15 years ago, very early in our journey here. And I remember I had asked her maybe once, is there any abuse going on at home? I forget how I asked the question. She said no. And then I see her in the emergency room beat up like this. And I kicked myself many, many times. What if I had asked her again? What if I had asked her 7 times? Would it have made a difference? So it's stories like that, that motivate us. And then the really motivational stories are the survivor stories of people who took their lives back. And yeah, we had a small part in it, right? We maybe nudged them a little bit, but it was them. They did it. They made it happen. So I think those inspirational stories also really drive us.
When I decided to become a doctor, it was to help people feel better. So by hook or by crook, I had to find out what was going wrong with them. If you, same thing, these people, we say that chronic problems that we can't find an answer for: fatigue, headache, abdominal pain. I still remember there was this one young girl, she kept calling me, and I couldn't I ran all the tests on her and I couldn't figure it out. And so one day I was like, okay, I'm just going to try and find out. We sat down and I started asking her the questions, and then the tears came, and then she told me everything, and she was so guilty. She thought it was her fault. It was her fault that the other person was behaving like this with her, why she was being put down, why she was being tormented. She tells me that I said some things to her that really changed her life, but I don't remember what I said. But, it's those things you really want to help them. And for me, I also feel that the perspective of people needs to change. We need to have a universal education, like you are. How do you educate the patient? But we need to educate our society in general how to treat human beings, with respect, with dignity.
Survivor stories are always powerful, and when you see something or read something, it really hits you hard. So I remember that I was talking to a Kaiser nurse, and she told me that she's doing a lot to raise awareness because she came to know another Kaiser nurse was murdered by her husband, and at that time she was she became speechless. And if that can happen to her educated class, so far she was thinking that it can only happen to poor class, uneducated class, but now she sees that it can happen to anybody and everybody. Domestic violence and partner violence can happen to anybody and everybody. And we all must do our part in preventing violence and family violence and abuse. We must do our part individually and collectively. Because it is our social responsibility. If we don't do our part, we won't be able to prevent domestic violence, violence against women, gender-based violence from our community, from larger society. Would you like to share some tips on how anyone can take part in preventing gender violence or relationship violence and abuse?
If you are a physician and if you're listening to this, reach out to me. If you're in the community, I can give you some tips on how you can screen your patients. If you're not a physician and you want to take part, I think you should definitely join one of these organizations. I know Maitri does an amazing job. They are always looking for people to handle the phones. You can do that. And I think we need to shift our mindset from survivors. We should not have any perpetrators. We should not have any abusers. So we need to train our kids when they are little. Teach our boys how to treat women with respect. That's the biggest contribution that a woman can have and improve the state of future women, Lead by example, live your life with dignity. Show your children how women should be treated. So you cannot be a doormat and expect your kids to treat others with respect. Lead on.
Yeah, I think those are great comments. I think be role models in the community is very important. We often will see stuff and we may not say something. Right? You may see somebody getting screamed at on the street. And how many people will just sort of shrink down and walk past? And how many people will say, hey, wait a second, what are you doing there? Why are you screaming at this person? So, again, we have to all step up and try to respect one another or show that respect of one another, role model it. And then going back to your other comment about the nurse story that you shared, we had a physician, a Kaiser Permanente physician here, this was maybe 20 years ago, murdered by her husband. So this has touched our own community of physicians. So when you talk about educational level, you're right, that has nothing to do with it. This is a universal problem, unfortunately. And in fact, sometimes these perpetrators of violence are very wily and very smart and sophisticated. And Priyanka mentioned using technology against people or stalking people, using technology. So it really can be quite disturbing when you see somebody who is perpetrating this in a very sophisticated way, which makes it somehow even scarier.
And if the perpetrators are very smart, and then it is difficult to prove in court, or because they are smart, they know how to hide the crime, and sometimes people think that only physical abuse, physical violence is domestic violence. And another thing is when someone is going through psychological abuse or gaslighting, as we pointed out, Priyanka, it's very hard to prove in court. It's very hard to, and sometimes survivors are also confused whether it is happening really or no. So this is a very gray area and a lot of work to be done, honestly. But I'm so thankful that you came. So thank you so much, Dr. Chaudhary and Dr. Jain, for taking time from your busy schedule and joining us in this prevention talk. I'm sure today's discussion will motivate many community members out there in thinking deeply about doing their part in ending gender violence, partner violence, and family violence. Listeners, please share this episode with your network so that together we can create a culture in our society where we will stop victim-blaming attitude and hold perpetrators accountable. Victims and survivors will know that they have options to get help. They don't have to suffer in silence. This is the time to say goodbye. Keep listening Maitri podcast Between Friends Conversation with Maitri. Find all our episodes on SoundCloud, Google, Spotify, and other podcast apps. Please like and share. On each episode, our guests share words of knowledge and information that can save someone's life. I'm your host, Nandini Ray, signing off today. Stay safe and stay happy. Thank you.
Thank you, Nandini.
Thanks, Nandini.
Starting this May, Maitri is hosting a curated speaker series where inspiring women will speak candidly about their successes, their careers, their life as immigrants, and much more. Attend these free and live webinars to listen to and engage in conversations with the speakers on topics related to individual financial security and success in careers. These workshops will be hosted first Saturdays of every month starting May till October from 3:30 to 4:30 p.m. For registration, email eep@maitri.org. See you there.
अगर आप या कोई और जिसे आप जानते हैं जो घरेलू और डोमेस्टिक वायलेंस से गुजर रहे हैं, कृपया मैत्री से संपर्क करें। मैत्री की सेवाएं बिल्कुल मुफ्त और विश्वसनीय हैं। हमारी सेवाएं हिंदी, पंजाबी, मराठी, गुजराती और अन्य दक्षिण एशियाई भाषाओं में उपलब्ध हैं। You can call us Monday to Friday 9 to 3 p.m. on 188-862-4874. For after hours, leave voicemail in your language. You can also email us at maitri, maitri@maitri.org.
This show is for informational purposes only and is not to be construed as legal advice. Always consult an attorney for legal advice. Views expressed by guests of the radio show are individual opinions and not endorsed by Maitri.